Well, Judy, it's good to be with you again today, and I really appreciate you taking the time to explain a few things to us. I know that you were at the testing at the high school today. How is that going over there?
It's going well. We had a busy morning. Typically at the remote testing sites, the first 2 hours are pretty busy, so people will wait about a half hour or so before getting their test. It's slowed down now, and we'll be there till 5 o'clock, so there's plenty of time to come out and quickly get a test for COVID.
So, what would be your advice to us right now in our community, just kind of looking at the recent events and the possibility of us having a pretty significant outbreak here with our meat processing plant and that, and just the close nature of our community?
I think given what's been happening in the past week or so, I would strongly encourage anybody that has any symptoms to come out and get tested. The testing is free, and it will help you know if you have been exposed and if you have disease or if you're fine.
Now, I know a lot of people are worried that if they get tested, they might lose their jobs. What do you say to that?
If you are tested, we do ask that you stay home and quarantine yourself until you know that you have negative results. And so that does mean that you shouldn't go to work. It shouldn't mean that your employer fires you. It should just mean that you don't go to work until you know that you're well.
Okay. I know here at our parish, we postponed our starting of public masses and that just for the idea. And I know a few of my parishioners have expressed concern because they're like, well, why is it that going to church is so dangerous, but going to Walmart or county market is fine? What is the difference between those things, an area of risk or an area of spreading the disease?
The things that we want people to think about, whether they're in Walmart or at church or any other family gathering, is how much time you spend with one another and how close you are in contact with one another. So if you can go to Walmart and you can maintain 6 feet distance from other people, you cannot spend more than 15 minutes in close contact with one individual. You wash your hands before you go in, you wash them when you get out, you're going to be relatively safe. What happens in more social situations, like a gathering at home or maybe even a gathering at church, is we come into closer contact. We tend to stand closer to those people. We might hug and forget that we're supposed to be 6 feet apart. It might feel more uncomfortable to wear a mask when you're talking with somebody that you know. But those things are what is going to protect you from getting COVID from other people.
So what I hear you saying then basically is kind of the amount of time you spend in contact with someone increases it quite a bit for spread, but also the location as well. I know here at the churches we've got a lot of procedures which are very good.
Yes.
And frankly, I think they are sufficient because they've been approved by a lot of the counties in that. But I think our concern here also is just the public messaging that we've been closed for 9 weeks to public mass. What's one more week or maybe 2 more weeks just to make sure that we're okay here in town?
Right. And particularly now, because we know that we do have COVID in this community, I think you need to make sure that you do pay attention to those social distancing things, staying 6 feet apart, wearing cloth masks when you do come together, because we do know that it is here.
Yeah. Another thing that I've heard from some parishioners is they think that this is all a big overreaction in our town. We haven't had it. We really haven't had many deaths in the area. A lot of people think if they get it, they're going to be just fine. And I know even talking to some of the parishioners here, a lot of people felt that even postponing the mass was an overreaction, although a lot of people thought that was a prudent thing to do. I guess, what would you say to the folks that kind of think that this is a farce, that corona's really not that bad, it's just like the flu, no big deal, we do it every winter?
Mm-hmm. Well, the unique thing about coronavirus is that our bodies don't recognize it the way it recognizes the flu. So all of us have some immunity to the flu because we've had it before. But with coronavirus, none of us have had it. And we don't know, we can't predict who's going to get really, really sick and who's just going to have mild symptoms. And so we need to make sure that not everybody is getting it all at once, which is why if we social distance and use masks and try to slow the spread, it's going to be easier for us as a community to weather this storm, because we have no other defense to this virus other than the precautions that we're putting in place. It's very easy to look back and say we could have done something differently. We don't want to put ourselves in a position where we're looking back and say we wish we would have done something differently.
Yeah. I just know, my sister lives in Madison. I got priest friends in Chicago, and just the difference of mask wearing down there, where 90 to 95% of people wear masks, and then up here maybe 5-10%. It's just kind of the different reality that way. What do you see, this weekend, this coming week? What can we maybe expect here in town? Kind of here. I mean, what would be, just based on other communities' experiences of this? What are some things for us to kind of be prepared for?
I think it's important as we learn more about how fast it's spreading here, that people take care of themselves, that they try to limit the contact that they have with other people. If you're going to the grocery store, please wear your mask and social distance. If you're going to a gathering with other people, please keep your distance. We know it's here and you can protect yourself. No one can do that any better than you can for yourself.
Is there anything else you wanted to share with us today?
No, I want everybody to stay happy and healthy, and so please, do what you can to keep your families healthy.
Well, we appreciate you coming down, and of course we're in the basement of St. Bernard's Church. You can probably hear our new roof is going on right now if you haven't been by the church for a while. So there's grass cutting, roof banging going on, and there was no noise when we were just talking before, but as soon as we hit the record button, so hopefully that wasn't too much of a distraction. But we appreciate everything you're doing at the county level, and we know that you're part of our community, and just everyone who's working and so generous. So we really appreciate it. Thank you.
Thank you.